What we're going to look at here is the way that the sciatic nerve essentially branches. So it comes down to about here, and then from there it actually splits into the two nerves which we just talked about. So the peroneal, which is basically this, and the tibial, which you can't see because it's not this one here, it's actually a lot deeper than the one that you are seeing there, which I'm going to show you that in a second though. But it literally travels right behind the calf muscle and the soleus muscle, and that's how deep it is. It's called the tibial nerve because it actually travels so close to the actual tibia, so it's very, very deep. Okay, and it's the reason why you know, most of the time people get injuries with the tibial nerve is because of its proximity to the tibia, which means that it's prone to being compressed by muscle tissue. So if the calf and the soleus become really, really tight, they can then apply pressure on top of the tibial nerve, which will then cause weakness, numbness, pain, burning sensations around the area. Let's just first uncover this nerve just so you can see exactly where that is. Okay, in order for me to do that, I'm going to have to get rid of the gastrocnemius, so the medial aspect and the lateral aspect. And then I'm also going to have to get rid of the sural nerve, which is again another branch here that we're not going to look at for the time being, so I'm going to hide that, right? And then I'm also going to have to hide the soleus muscle and the Achilles, and then I could kind of hide the plantaris as well. But anyway, so you can actually see the tibial nerve there. So you can see the difference now between the tibial nerve, which I was looking for, and the sural nerve, which was the one that's a bit more superficial. And the tibial nerve is essentially that deep part of that sciatic nerve. So you can see it starts from here, right? So I've just selected that now, and you can see where it essentially branches off. So around this point somewhere, this is where it branches out, and then it slides down towards in between the two gastrocnemius heads and right behind the soleus muscle. Okay, so you can see it is very thick. You can see that it kind of you should be able to spot it from there because it is different to the other nerves around it, because the other ones are just smaller branches like this. But you can see how this one just kind of splits the leg in two. Okay, now again, there is muscle here that I'm going to remove, like this is the tib posterior, which is a muscle that is usually related to Shin Splints, which we are going to cover in a separate video as well. I'm going to remove the flexor hallucis and then the flexor digitorum longus, just so you can see the proximity of this nerve to the actual tibia. So this is the tibia and this is the nerve. Okay, so see how close that is.